I'm Dan Mullen. I'm an orthopedic surgeon in Arizona, specializing in large joint reconstructions, repairs, and replacements. I was the first kid in my family to go to college. I grew up in Pennsylvania. I went to college at the University of Notre Dame, spent 4 years there, and graduated with a Bachelor's of Science degree. I came back to my hometown in Pennsylvania and went to Temple University School of Medicine for my medical school. That was another 4 years there. After that, I was happy to match into an orthopedic residency program in Baltimore, Maryland. I spent 5 years there. That was focused out of the Union Memorial Hospital, Johns Hopkins University Hospital, and the Maryland Shock Trauma Center. After that, I went to Cleveland, Ohio. I was chosen to do a sports medicine and minimally invasive sports fellowship at the Cleveland Clinic, and I spent 1 year there. Knee replacement surgery makes up a huge part of my practice. I've been a doctor since 1996, and I've done over 10,000 knee replacement surgeries. The technology that has evolved over the past 20 plus years of me being a surgeon is dramatic. What we used to do through 6 or 7 inch incisions, we're now doing through 3 and 4 inch incisions. We're using digitized tomography, we're using computerized systems, we're using robotic technology, we're using muscle sparing approaches. All of that technology, medical advancement, coupled with our 2+ decades of surgical experience, has led to tremendous clinical results for so many of our patients. As much as knee replacement is a big part of our practice, so is hip replacement surgery. There's all different ways the surgeon can approach the actual anatomy of the hip joint while doing a total hip replacement. When it comes to which approach I use, I've used the anterior approach, the posterior approach, the lateral approach, the direct superior approach. I find that each approach has its applicability and utility, and catering that approach to each particular patient is probably more important than choosing any one approach for everybody. Hip replacements has been a huge part of our practice for the past 2 decades. We've done over 10,000 reconstructive surgeries, and many of them have been hip replacements. My team and I have developed a very gentle surgical approach, a muscle-sparing approach where no muscle is cut in the knee nor the hip. You need to choose a surgeon who understands not only that the technology is helpful, but they are still controlling that technology. And the muscle-sparing and the minimally invasive approach has been shown many times to lead to more predictable and faster results. After completing specialty training in 2002, I moved to Arizona, and I've been in practice here doing orthopedic surgery ever since. Not only have I developed a very thriving orthopedic surgical practice, I've also been blessed to have a terrific family. My wife's a pediatrician, good doctor in her own right, and together we have 3 beautiful children. One of the things we like best about Arizona is our climate. I hate to rub it into my family in Pennsylvania when they get their snow and their rain, but we get to take advantage of sunshine just about every day. We love to golf, we love to hike, we love to swim, we spend a lot of time outdoors. It's a fabulous place to grow up, it's a fabulous place to have a family.